She was busy working and going to school here at Northern Kentucky University when Gabby says she felt a lump in her breast one day in the shower.
And I just kind of pushed it off because I didn't expect anything.
She didn't expect anything, she eventually told Dr. Matthew Kurian here at Kentucky's St. Elizabeth Cancer Center because she was so young.
I'm 22 now and I got diagnosed at 21.
Luckily, when Gabby was diagnosed with breast cancer, Dr. Kurian was able to personalize her care and treatment, so she is now back on the road to recovery.
The term that we use nowadays in medical oncology is called precision medicine, and I think that nowadays we are trying to analyze people's cancer at a molecular level and trying to understand what makes it tick.
Perhaps never is this more important than right now, as this new study released by the American Cancer Society tells us.
The risk for developing cancer, including colorectal cancer, uterine cancer, liver cancer, and breast cancer, you are more likely to develop cancer in your 30s and 40s if you were born in the 1990s and 1980s than your parents were who were born in the 1950s and 1940s.
Dr. Doug Flora, Vice Chair of the Midwest Regional American Cancer Society Board and the Executive Medical Director here at this cancer center, tells me.
This study really codifies what we are seeing in clinic for the last couple of years. There have been a lot of really hard, sad cases here where we've had people who are much younger than expected presenting for cancers that are typically thought of as old person's cancers.
So the first logical question that comes up is, do we know why?
The authors of the study have posited is that probably there's been some exposure of these earlier generations to something in their early developmental phases.
Dr. Flora says that could be anything from environmental toxins to diet differences, which can lead to mutations, which can cause a cancer later.
Something is driving mutations at a decade or two earlier than in generations past.
Now, one important note, this study was completed right before the COVID-19 pandemic. A lot of people have asked me, could this be related to the virus that causes COVID or even the vaccine? But we cannot attribute these numbers to any health-related interventions during that time frame.
From breaking news to feel-good stories, Local 12 has it all. Tap subscribe and click the links for more content like this.